So I'm here at the doctor's office because I've come for like to work on my lower back and my neck pain, but I'm also here to work on my frequent urination problem. I wake up at least 5 or 6 times in a night, almost every hour, just to go pee, and it's really affecting my sleep cycle. It's really affecting my work life the next day because I don't get enough sleep. So this is what I'm here for, mainly to get fixed.
So right now we're using this instrumentation device over here. What it does is it detects for changes in skin temperature differences. And when there's a structural abnormality that irritates the surrounding nearby nerves, nerves can get irritated and inflamed. And when that happens, it causes a change in skin temperatures. And that's what we're looking for. The next thing we're checking for is there any alteration in the surface of the skin, any changes in the tissue, okay. Is there any muscle tightness, is there any swelling present? Okay. So what we find here is there's some swelling in this tissue right over here, and there's also some tissue swelling right over here as well. So to mark these levels, there well. In addition to, the muscles in the region over here is nice and smooth, whereas over here is nice and tight. Okay, so that indicates something is muscles here, they're protecting and trying to stabilize this joint structure right there. And the same story as well. Over here, it's nice and smooth and soft. Over here is smooth, here's tight, here's also tight as well. So on both sides a little tight. Feel. Right now we're also testing and checking. A normal structure should move in all directions without any problems. However, what we're finding right now is the sacrum right here is not moving towards the left. And it's not moving towards the right as well either. So it tells us most likely this is a base posterior sacrum right over here. We're checking every single structure. See what else is not moving. Tendon right there, huh? So this one right over here is not moving too well. In this X-ray structural analysis, as we can see, we have a rotatory scoliosis. The spine is rotating all along. And that's coming from the foundation right over here. This sacrum is at this angle right now. Ideally, we want to see it here. not here. In addition to, the sacrum over here, ideally should be here. Instead, it's rotated over to the right, causing the rest of the bones, just like Jenga, to follow along. And they rotate, putting a lot of pressure on this 11th dorsal, resulting in the kidneys not to function properly, and rotating the head quite a bit, resulting in that neck pain. So the solution is, this one right here, we need to structurally correct the foundation. That'll take a lot of the rotational tension off of the 11th dorsal and her neck as well. That's what we need to fix. The main function of the kidneys is to filter out waste from the blood, and it does so at 200 quarts per day. 2 quarts and does at urine, and 198 quarts gets reabsorbed back into the body. Now, in this case, due to a structural abnormality at the 11th dorsal, this particular nerve, when it gets irritated and interfered, it goes right to the kidneys. Now, due to that nerve interference, the kidneys are no longer receiving the appropriate command to reabsorb all that 198 quarts. Therefore, more liquid gets dumped down the uterus, filling up the bladder, resulting in that frequent urination. Nice and shoulder right over here. Chin that way, please. Thank you. We're going to roll you over. Just let it go. Pull that shoulder right there. A little more.
Oh.
Okay. Okay. 1, 2, 7, 8, 11th. It'll go right there. Those. There we go. Okay, fill us in. How are things since the last visit?
So things since last visit have been great. I have not been getting up to go urinate at night, so it's been really great. I think out of the 5 or 6 times that I used to get up, it's gone down to 1, but it only happened like twice out of every day last week, so that's great. Yay.
All right, so let's keep it up.
Yeah. So I came here for the neck pain, but really just by fixing my foundation, my neck pain has automatically disappeared, which is really great because we haven't really done anything to it. So I'm really happy with the results that I've had so far, and this past week has been great with like no back pain, no getting up for frequent urination, so it's great.